Good morning, good afternoon, or good evening, depending on where you are in the world. And welcome to today's talk, which is on a subject of democratizing digital health development. My name is Matt Brady. I'm head of content healthcare EMEA at Informa Markets in Dubai. And I'm joined today by María, Clara, Mesa, who is Chief Operating Officer at Alternova, a tech company that develops interactive digital health apps and platforms based in San Francisco. María is at the forefront of the digital health revolution. Alternova believes the future of medicine is digital, envisioning a world in which digital technology transforms the patient experience, increases patient engagement with treatment, and improves access to and accuracy in diagnosing conditions, which includes mental health. Welcome, María.
Thank you, Matt. Thank you for having me here.
It's a pleasure. So I just want to begin by drawing attention to an interesting insight which came about from our latest survey of the healthcare industry. So the survey is called Voice of the Healthcare Industry Markets Outlook. It's an annual survey looking at sentiments across the industry. And according to the survey, healthcare organizations in the Americas will be prioritizing digitalization as a technological investment over the next 12 months. And that's followed by other technological investments, which includes artificial intelligence, big data, cybersecurity, robotics, and others, like virtual reality, for instance. So I guess, my first question is, from your perspective, being at the forefront of all of this and knowing just how important this is, being accelerated, for instance, in a pandemic around the world, where are we at in terms of digital health? What is the current status of this?
Well, I believe that commercial mobile devices and also computers are becoming more readily available for the world in general. And that is going to allow people to have a lot of data about themselves. And I really think that digital health is going to empower us over that data, that our interactions with devices that we have and that we use every day give. So I think where digital health is going is to empower people, humans in general, to have data in their pockets, in their devices that they use every day, that are going to give them control over their health. So I see that. I also see that people, companies, and also patients and consumers are starting to pay more attention to the patient experience. Everybody's starting to realize and to talk about how the healthcare experience is just not fun for patients, for doctors, for any of the stakeholders involved. So I think digital health is going towards how can we make that patient and that provider experience more engaging, more fun, easier, seamless, without a lot of paperwork, and I think a little bit, easier in general. Also, I see that innovations happening in countries such as the US and Germany, for example, are going to be extrapolated to countries that really need them. Because I really believe that the power of technology and that the impact that technology can bring to this industry is really democratizing and opening the door and the alternative for people around the world to have access to health. So I really want digital health to go there, to be the tool through which, because technology is just a way through that healthcare can be given or offered. So I really believe that that's where digital health is going, to the democratization of healthcare access.
Yeah, it's really interesting. You mentioned this, and in particular, data, for instance, which I think is really changing the world generally, not just in healthcare, obviously, but right across all sectors. And all the talk now is around data. And I guess with that comes, certain, concerns which might be, regulatory concerns over, the misuse of data, for instance, the security, the privacy of data. But I guess my question is now, what are the main barriers to innovation in digital health? And it might not just include data, but or regulations, but general barriers that include technology, for instance?
Well, I really believe that there are different types of barriers, starting with figuring out what's the business model that can make this work for companies, because doing good means that companies also are gonna do good. So I think the companies like Peer Therapeutics and Akili Interactive are the ones that are showing the world and that are trying out different ways in which digital therapies can work for patients, but also for commercial companies to make a living and to generate value for the different stakeholders, starting with patients. So I really like, that's not a barrier, that's just where the industry is at. Companies are figuring out what the most efficient business models are. So that's a challenge. I wouldn't say it's a barrier. And I think that there are brave companies showing the world how those business models are going to work. So that will be the first one. The second one is the hardware. Of course, hardware is one of the things that is generating innovation and that is going to make digital health readily available for people, and that includes wearables, for example. And I believe that type of technology is getting cheaper and more accessible, but there's still plenty of development and innovation to be done for that technology to be available for the world. And I go back to my point on the last question you asked me about how this technology should be available for countries that are more that are not the US or the rich European countries. So the price of hardware would be another one. And definitely another one is awareness, because not everybody in the healthcare ecosystem is aware of how to incorporate digital technology into their ecosystem and how that can make their lives easier and their patients' life easier. And by that, I mean also even pharmaceutical companies. From conversations I've had, there are many of them that are still figuring out how to implement digital transformation into their strategies. So I think awareness and even like education as of how digital technology can be incorporated in different points of the healthcare experience is another, I wouldn't say barrier, I would say challenge or thing that we're going through. So definitely generating awareness is another point. And a point that you mentioned earlier about privacy of the data, I think people don't talk enough about the ethics and what's going on with that data and how companies are going to make a profit out of that data and how patients should get also a benefit from that profit. So that's definitely another one, discussions about ethics and about how to handle and use properly that data.
Yeah, thank you. Those are really powerful points, and it's very interesting how you brought up ethics, and of course, ethics is very much in the spotlight at the moment over, the role of big tech, I guess, in society. So just looking at the Americas in particular as a region, and within the Americas, Latin America, how does this region differ, or this part of the world differ from other parts of the world in terms of embracing digital health or innovating in digital health? So I'm based in Dubai, and there's a lot of activity in this part of the world, and organizations in healthcare are adopting digital health to a very large extent. But from your point of view in the Americas, how does it differ?
Well, I am Colombian. I am from Latin America, from South America, and I live in San Francisco, which is one of the most advanced cities in the world in this space. And we all know that the US is going really fast into digitalizing or digitizing healthcare data, and that electronic medical records are public now, and patients and providers can have access to that data to use it, I wish, in favor of the patient experience. So if I compare, for example, the situation between the US, where medical records are digital, and if I think about my country, that is Colombia, here in most cities, in most towns, digital health records don't exist. They're still a paper. So definitely it's a huge difference. In the US, they're completely digital. In Colombia, most of them are completely on paper. So it's like black and white, I would say. But there's also a great experience for companies here to innovate and to start creating those digital medical records. So I definitely see a huge gap, but also a huge opportunity for countries in other parts of the world to learn how they can create versions of those electronic medical records in a Colombianized or Latin Americanized way. And that means there is a huge opportunity for companies to innovate here. So I see a huge gap, but also a huge opportunity for businesses to create value in regions like mine.
That sounds really exciting, and it's not just a business opportunity. I guess it empowers the patients at the end of the day. It empowers the patients, and that's really key. My next question is around your solution. So Cardinal Kit in particular, and I was taking a look at this, and it looks really intriguing. Can you tell us more about its purpose and who it's for exactly?
Absolutely. So developing digital health solutions it's hard. It takes a lot of time. It takes a lot of money, and it's really risky. I think all of us colleagues in this industry know about that. And definitely the data side of things, the back end of things, how we build the pipelines that collect data from the applications that we build is a crucial thing, and how we protect and respect the data that is collected through digital health applications. So what we want to do with Cardinal Kit, which is an open source solution, an open source framework that we're creating in alliance with the Stanford Center for Biodesign, is democratizing the development of digital health solutions and applications. And what we have done there is, or what we're doing there, is building an open source, very scalable platform that is able to collect mobile and wearable healthcare data. And it is being used by developers, by startups, by physicians, by multiple clinical studies inside Stanford, and those stakeholders I may call digital innovators, digital health innovators. And it is designed to accelerate rapid prototyping, rapid development, and enhancement, or tools to enhance digital health applications. And where I see this going on, or how this works in very easy terms, is Cardinal Kit is basically a pre-built backend to which you can plug in your digital health application, build your pipeline, and in one interface, you can see all the data that your application collects, plus all the healthcare data that your phone and all the wearables that you have connected to your phone collect in only one interface, and all of that data correlated. And we're building a layer on top of that data to be able to connect to EMRs. So we're able to pull and push data from them. And basically, as I say, Cardinal Kit is one interface where you're going to be able to see all of one patient's information from the past and in real time. So this is going to allow companies to develop digital health applications faster, cheaper, easier, in a more compliant way. And this can be also the basis to create consumer-facing solutions where patients and stakeholders in the healthcare ecosystem can have all the data that they need in one interface. This is in early stages. We have already built the iOS version, and the Android version is coming. And this can turn into many exciting different products and ecosystems to democratize digital health. And that's exactly what we're trying to figure out in alliance with Stanford. How can we make this technology readily available for the world?
Oh, it sounds really exciting, and it's such a noble purpose or goal. It's so meaningful. Is there much training required, or even like a cultural shift in organizations? So I guess, some are more advanced than others in being able to understand data and so forth. But, is there like some sort of, a gap or deficit that needs to be addressed?
Yeah, I believe there's a lot of education and awareness that needs to be done. And that's part of the things that we're trying to do. For example, opening and offering webinars to the general public where we explain from the basis, like, why is it important to visualize this data? Why is it important to put it in the hands of patients? Why is it important to have it in one interface and to start correlating all of that data? For example, to start giving patients alerts on how their sleep correlates with their activity and with their heart biomarkers, etc., and how that data can be turned into alerts, for example, for physicians to be more proactive and less reactive. And all of this in favor of health of human beings in general. So definitely there's a barrier in which we need to generate awareness to the world as of why this data is important and why we should pay attention to how we produce it, how we store it, how we process it, and in hands of whom it is.
Yeah, no, that makes a lot of sense. And so what can you say about the privacy or security of this data? Because obviously there are many concerns, expressed among the public, for instance, in the safeguarding of their health data. What can you say about that in regards to Cardinal Kit?
Well, I would say that the American government has done a lot of efforts to generate robust frameworks to protect the data that is generated through digital health applications. And definitely Cardinal Kit is built in a completely HIPAA compliant manner, where this code, this is an open source technology. So literally what it is in a repository. And if you want to use it, you just copy and paste the data, and you can be sure that the way data is collected and stored is completely HIPAA compliant. And anyways, if you use Cardinal Kit code, you're gonna create your own instance. So nobody else is gonna have access to the data that you're collecting through your app. And is data, as I said, is gonna be collected in a HIPAA compliant manner. So it's definitely built following all of the American up-to-date regulation regarding how to protect that data.
Perfect. Thank you. And something that jumped out at me when I was looking at your website, at the homepage, and I mentioned it earlier, well, actually, when I introduced this talk, and that's mental health. And of course, mental health is something that has occupied our minds throughout the course of this pandemic. Many of us are going through anxiety. It's become less of a stigma, I guess, and we're all willing to kind of address it in a way never before. How do your solutions, that includes Cardinal Kit, for instance, how do they confront mental health or help patients navigate mental health issues?
Well, first of all, one of my biggest passions, I would say, is understanding the human condition. I really believe that humans are a very complex machine, a very beautiful machine, and we all have things that we need to deal with. So mental health is not something that only depressed or anxious patients, if we can call it like that, face. All of us humans struggle because we all live in here. So I believe mental health, it's something that we all are working on and should work on every day. And digital experiences, for example, a video game, which is one of the things that we're experts in, are an experience that is composed of mechanics, of art, of color, of music. It's the same thing as going through a trauma or a meditation experience. Experiences modify your brain. So we really need to take care about what are the digital experiences that we build, because those experiences, if you're in front of them, they're gonna change your brain, either you want it or not. So I really believe that there's a lot of potential, particularly thinking about mental health, to think about how we can leverage on creating interactive experiences that are more democratic and scalable to be able to shape and to help human beings thrive. So the data that can be collected through your interaction, for example, with a video game is amazing because you cannot fake how you react and how you interact with a game. So it's basically, technology is at a point where if you interact with a digital experience, you can have data in your pocket, coming back to the first question you asked me about how your brain works. And I really believe that where mental health is going is to how can we leverage and how can we hack our biology by being aware of how our brain works. So to answer your question, I really believe that there's a huge potential starting with mental health, because that's something that we all humans struggle with, that we can leverage from by using interactive applications that can help us understand how our brain works and how our brain operates and how we can make it work better in our favor.
I think this sounds wonderful. I'm just saying this as a personal sentiment, and I think many of us are maybe reluctant to talk to a professional or a human about it, but maybe we feel more comfortable interacting with digital technologies, and we're like you and I now. So, which brings me to ask you about the video game. So I love gaming. I've always loved video games. I'm not afraid to admit that. So how might this work in the context of mental health? So do I control a character, jump up, jump down, make choices? I'm not sure how this works.
Literally like that. I really admire the work of the scientists that we're working with. And to mention them, because I really admire them and I want to make the world aware of their work. We work with the neuroscience department at UCSF and also with the Gabrieli lab at MIT. And what these brilliant scientists are trying to figure out is how to create experiences as medicine. And inside those experiences, one of them is video games. And they're trying to figure out how, by creating a workout for your mind, an experience that you repeat and that adapts to you, you can train your brain and modify it. So it's basically a workout for your mind where you're gonna, like, in the end, what I think this is gonna be is it's gonna replace a lot of the pharmaceutical products, for example, Ritalin or Adderall, particularly for kids, where instead of giving someone a formula that, like the same formula for all patients that have anxiety or the same formula for patients that have ADHD, you're gonna have a personalized medicine in your pocket that is designed for Matt and that is designed for Maria and that is not the same for you and for me, even though we both suffer from anxiety, let's say, or from depression. So I really think that another point, besides democratizing access to proper diagnosis and to proper intervention, is access to personalized medicine. What video games really are and what these scientists are trying to figure out is how to create a personalized experience that can really modify your brain and help you deal and thrive with your anxiety or with your depression. So that's really the potential, creating personalized and democratic solutions for allowing humans to thrive and to live better with their mental health conditions.
That sounds really revolutionary in its own way. And would this apply to all demographics or just children? So for instance, I'm thinking, you and I, we finish this call, I'll be like, glad it's over, a little bit hyper, play my game for an hour and it corrects some sort of, functioning of a brain. Is that how that might work, or how do you see this?
This works for all demographics. We're building things for kids starting at 4 years old and also for seniors, for example. We're building an experience in VR at the moment for the neuroscience department at UCSF. It is a VR and a tablet experience. They're testing and doing clinical trials with both. And this experience is meant to identify early signals of Alzheimer's and dementia and exercise short-term memory. So that, to answer your question, we're building a broad spectrum of applications and tools, digital tools, that are for all the spectrum of demographics, from kids that are 4 years old to seniors. So I believe that this is for everybody.
And what are your plans looking ahead? So, obviously technology is changing so quickly. We're seeing 5G and there's talk of 6G on the horizon. Artificial intelligence continues to evolve. The Internet of Medical Things and other innovations happening behind the scenes. What is it that you'd like to do in terms of your projects going forward, maybe the next 5 years or so?
Well, we are a software development company that is completely focused in digital health. So we are developing technology for different entities, such as UCSF, MIT, Takeda, and a bunch of very, very interesting and impactful startups. So we want to keep building technology for others because that's an indirect way in which we create impact and we generate solutions that are going to change the scene, the healthcare scene. And we're also looking for opportunities to develop our own IP, our own products. And that is exactly what Cardinal Kit means to us. Cardinal Kit is our first tangible bet in alliance with Stanford, as I mentioned at the beginning, to generate our own product. And at the moment, what we're trying to figure out is how to build a business model around Cardinal Kit that can generate the impact that we want, but that also can help us scale and grow in a sustainable and scalable manner as a business. So I would say, we want to keep building technology for others, and at the same time, we're looking for an opportunity to build our own impactful and scalable solution that is going to allow us to create direct impact and also grow exponentially as a business.
So, all this sounds tremendously exciting to my ears. It seems like this is the right time with the pandemic, with this acceleration of technologies. Healthcare organizations are, starting to take notice in a very big way. Mental health, of course, we're seeing major sports stars now, making mental health issues more, better known, I guess, and it's become more acceptable to talk about these. Where do you see, digital health generally going in the years ahead? So, what is the future of digital medicine? It seems like the possibilities are endless. And I should have it. This is a final question, unfortunately, because we are running out of time.
So I really believe that health is gonna be the new social. As for example, fitness is right now, like applications like Strava and things like that, where people work out and they're proud of it and they want to share with all of their network, and they say, yeah, no, I run from this point to this point. I really believe that healthcare is gonna be the new social, and that people are gonna start, as I said at the beginning, being more empowered about how their health works and how they can make it work better, and how they can leverage on their biology and make it work in an efficient way. So I believe that health is going to be the new social. And as I said, that is going to be powered by trends like patient-centered models. What I said at the beginning, people paying more attention to the patient experience, by wearables and hardware getting cheaper, and of course by progress in AI. And that is related with the point that we talked about ethics, because AI is not magic. AI is built by humans. And definitely we have to think about what are the ethics and the values behind building those AI algorithms. So to answer your question in a precise way, I believe that health is going to be the new social, and that having data in our pockets, in our phone, is going to allow humans, and is going to allow patients, and is going to allow providers, humans in general, to hack their health. And this is not something that is going to be available, like this is, as it is now, only to peak performers that have access to scientists and to a very expensive hardware that can measure how they perform and how their biology works. But this is going to be available for consumers. So tools to hack your health. And I believe that that's where healthcare is going.
Thank you. I think that sounds really amazing. And speaking again personally and frankly, I've been waiting for this moment for a long, long time as a patient, as an individual, as a human. I've been waiting years for this. And I remember even, 10 years ago, there was talk of, the quantified self movement and tracking one's health data. And it was very, very, basic in its form. And it struck me as something very curious, because we know more around football teams in a league table and how they perform. We know more about the weather and how the weather changes, but we don't really know much about our own personal health data. And that can range from mood to something more clinical, perhaps. And I guess what we're waiting for is this kind of revolution which empowers people like myself to take greater control of my data and try to understand my functioning better as a human. And I think it starts now. So this is really very powerful to hear.
I agree, and that is related to habit formation, because if you are aware about how building good habits in your life really alters your biomarkers and make them better, I think that's a motivation, that's an encouragement, that's an objective and rational reason why you should develop good habits in your life. So I believe that this is going to change, for example, the diabetes scene in countries like the US that struggle with that.
Well, on that note, so we have to wrap this up. And again, I want to thank you for your time. I think it's very interesting hearing all of this and this journey that you've embarked on. And I hope what you said has inspired anyone listening to explore this further. Thanks again.
Thank you. Thank you for having me here. Thank you for your interest. Thank you for your questions. And I hope I'll see you again. Thank you so much, Matt.
Okay.